Okay, so let's go in front of the leg here. So we're going to do some nice effleurage, and then you're going to start up here, right up by the inguinal ligament. So you're going to have 3 aspects of this. Again, I'm going a little faster there than normal just for filming purposes. But you should know by now your rhythm. 5 to 7 reps, as always. So we're pushing it up into the inguinal ligament area where all the inguinal nodes are. So now I'm just showing you some different techniques you can use. Obviously you've got to be careful with that left hand, you know, getting too close to the groin. But you know, you just got to be careful, respectful of course. Drape them properly. And then we just of course work further down. I'm using 2-handed stationary circles, and I'll show you just several different techniques again. But so it's really important the lymph nodes here, because you're working the medial side, lots of lymph nodes. So I work medially and then right on top of the thigh muscle. I generally work 3 aspects, and again it all depends. So medial, lateral and anterior. So on top of the thigh, inside of the thigh and outside of the thigh. And when I work the outside of the thigh, as I'll show you shortly, I work sort of in towards the groin. See here? So I work it up and in. See? Up and in towards that groin area. So it's not just straight up the side of the leg. We're going to work it up in towards those, in towards the midline, if you like. So superior and medially, as you can see there. We just work our way down the thigh there. So as you can see through the whole course, it's really important to have the person draped well. Now this is a pump and stationary circle technique. You might like to use this. You pump it up and then use a stationary circle. Double hand stationary circles. So any of the techniques, as I've said before, that you really like to use, just one hand, whatever you find easiest. Obviously 2 hands together is going to be better on a larger person, because you cover more space. And you just really want to work these well, clearing out through the inguinal nodes there, up towards them. Okay, so once you've done the thigh, we're going to work the knee. Now I'll show you a couple of ways. One can just be the pump, and you start below the knee using this pumping method. Just wrapping that hand around the knee. And this is perfect for someone small like Liam, and just right up above the knee there. So start below, go on top, keep as much contact as you can, and working up there. So that's perfect for Liam. Now if you've got someone larger, then you can use this 2-handed technique of pumping it up through there as well. Of course you could use stationary circles. I find this really good because you're working the whole knee. I've got my hands wrapped right around. Really, really effective. Okay, now we've got these lymph nodes behind the knee, the popliteal fossa. So what I do, you wrap my hands around it, see how I've got my fingers like that. You put it there, and I'll start a little distally, just below the crease of the knee, and start working, and I'll show you how I'm doing this, but it's pushing it up again towards the bottom, if you like. So you see that's the movement I'm doing. That's the movement, like, I don't know what you call that, but kind of a circular movement going up and pushing it up towards the head, if you like. So I do that, and then I move up a half an inch, and so I do that, and we stimulate that popliteal fossa for those lymph nodes back in the back of the knee. So we want those really well activated, stimulated. as I said earlier on in the course, several of the lymphatic vessels from the Achilles and the calf go up into that before they go up further to the inguinals and go up into the trunk. So now we're going to do the shin area. So again, you can do stationary circles, 2 hands, this pump technique. Again, whatever you prefer, what we find best on the type of client you're working on. And then coming down this lateral aspect here, down your tibialis anterior. And just working, making sure you're getting all of that leg, the lower leg, there. Okay, so now we're going to just bring up that leg there. So the foot's on the ground. I like to put just the soft part of my leg on there, just to hold that on the foot, just to hold that there. And now you're going to work the calf. Now, 2-handed pump method I find is excellent. Working up towards the back of the knee to that popliteal lymph node. 1 hand for Liam, most certainly. Again, just depends on the size of your hands and the size of your client's calves. Whatever you find best. So you put that into this position here and you get really good access to the calf. Soft hands, getting as much surface area contact as you can to make your work most effective. Work all the way down to the Achilles tendon down there. Can just put your hand behind the knee to drop it down so you don't hurt the knee. Okay, and then the ankle. So several different ways you can work the ankle. So the front of the foot there, front of the ankle. Working thumbs, alternating thumbs. Again, not dragging on the skin, you're pushing the skin. You can also use this technique, pumping technique. I'll just change hands there to make it better for the camera angle. You can use stationary circles. So again, I'm just showing you different techniques. Again, what you find easiest. You can use 2 thumbs together like that. Whatever it is to move the lymph through the ankle, up from the foot and the ankle. Now I'll show you at the back of the ankle here, using the fingertips, or the pads of the fingers. Again, just working them up. So you see it's a really thorough treatment. Okay, once you got that there, you can see here, we just work the top of the foot. Just working through. And just like you did with the hands and the fingers, you're going to work the toes as well. Going along the tops of the toes. And there you have it. Just working through there. Getting all that lymph. Pushing it up. Once you've done the toes, you can just work the top of the foot again. Again, all depending on the time you've got, how long you want to do the treatment for. So there you have it.